So, madam, welcome to Cherish TV. Please tell us something brief about cervical cancer.
Okay, my name is Midwife Sicho. Cervical cancer is the cancer of the cervix, just to put it. But then, what is the cervix? The cervix is the neck of a woman's womb or the mouth of the womb. And then, cancer is when the cells around your cervix grow abnormally. That is cervical cancer. Now, what causes cervical cancer? Cervical cancer is caused by a virus, which is called the human papilloma virus. Simply put, we say HPV. How do we get this HPV? We normally get it through sexual intercourse, or when you have sexual contact with somebody, you can come into contact with this virus. Now, who is at risk of getting cervical cancer? If you start sexual intercourse at a very early stage, especially less than 18 years, you are at a higher risk of getting cervical cancer. If you have multiple sexual partners, or if you have partners with multiple sexual partners, you are also at a higher risk. If you are having recurrent sexually transmitted infections, if you smoke a lot, you are also at risk of having cervical cancer. Now, what are the signs and symptoms of cervical cancer? Cervical cancer will rarely give you signs and symptoms until it advances to the late stage. So you might start having signs like recurrent vaginal infections. You have pain during sexual intercourse. You can have pelvic pain. You can also have bleeding in between periods or bleeding after sexual intercourse. Then we have our menopause women bleeding even after they are in their menopause. These are some of the signs and symptoms that you might have. But these signs and symptoms could also be another thing apart from cervical cancer. So it's advisable that when you are having any of these signs and symptoms, you go to the hospital for a checkup. Now, how do you know that you are advancing to cervical cancer? You need to go through some screening processes. So we have the visual inspection and the acetic acid or vinegar, which we also do to inspect your cervix and dictate if the cells there are growing abnormally. Then we have the pap smear, which you can also go to the hospital. They take the cells of your cervix, take it to a lab, and then they examine to see if the cells are growing abnormally. Then we have the last one, which is the HPV testing. That will be able to dictate if you have the virus that causes the cancer. Now, this virus we are talking about is in two strands. We have the low risk one and the high risk one. So the high risk one is what causes the cancer. The low risk one is likely to cause you a genital wart. So we are advising all our women out there to go to the various hospitals close by, get themselves screened, and then protect themselves against this cancer. Thank you.
Okay, so thank you very much. When you come across this video, we will urge you to share. And we will plead with all ladies to rush to various hospitals right now. Get yourself screened against this cancer before it's too late. Thank you.